I'm Dr. Divya Srinivasa. I'm a double board certified plastic surgeon. I specialize in breast reconstruction for patients who are undergoing breast cancer therapy and breast cancer surgery. I specialize in breast reconstruction, which really includes all of the surgical reconstructive options for women who are undergoing surgery for breast cancer. This can range anywhere from having a lumpectomy, or some tissue removed as part of removal of the cancer, to removal of the whole breast, or a mastectomy. And the final piece, and really what I think is the most important aspect of being a reconstructive breast surgeon, is that I'm a microsurgeon. Microsurgery is the art of basically doing a transplant, but in the same body. And I can transplant that tissue from anywhere in your body to reconstruct a breast. Once you get your own tissue transferred to make a breast, that lasts forever, and you can make it look however you want. I take a lot of pride in the fact that my practice is dedicated to breast reconstruction for cancer patients. One of the things that I tell all of my patients, this is what I do every single day, 100% of the time. You're not competing for my attention with another cosmetic case. It's not about that. I'm a part of the team, I'm a part of the cancer care team, and I'm a part of your cancer care team. The staff to me they are some of the most important human beings. Having staff that understands, hey, it's okay that you're running late because your infusion ran a little late. It's fine, come on in. There are some really unique parts of my practice, and having staff that embrace it, that understand it, absolutely critically important. And when I was hiring, that to me was at the top of my list. I want my patients to feel better about themselves after breast cancer than they did walking into my office. Getting a breast cancer diagnosis is of course devastating. It turns your world upside down. It's unexpected. And oftentimes the goal is perceived as being, okay, well, I just restore or do your best to make it workable. And that's fine, but that's not my goal. My goal is for you to walk out at the end of this saying, I look better than I did before I even knew I had breast cancer. I actually tell every patient when they come in for their first visit, and of course it's emotional, devastating diagnosis, and I say, I know right now sucks. I know that it's a lot, I know that you're overwhelmed, but before you know it, you're gonna blink and it's gonna be 6 months from now, and we're actually gonna meet, and you wouldn't have seen me for a couple of months, and you've gone back to your life. It's hard to imagine, but you've actually forgotten that you had breast cancer because you've moved on and you're better and you're healed. And that 6-month visit is so awesome because then we get to talk about things like, oh my gosh, my belly looks so good. I wear a 2-piece bathing suit. And you know what? I hadn't even done that since I had kids. I can't tell you how many times I hear that. And that for me that's a win. I've done my job if that's how the patient feels after breast reconstruction.